My fellow human being, whoever you are, wherever you live, I love you. This is Dr. B, Dr. B A+. I am the doctor who genuinely loves you. I am the doctor who genuinely cares about you. And I swear to God, I say this from the bottom of my heart. And before we start, don't forget that Dr. B is here on YouTube for the love of teaching medicine to regular people like you, so that you can benefit from my vast knowledge in medicine and surgery. And you can, just like me, age gracefully, and die just like me, in your bed, in your sleep, God willing, at the age of 100. Today I want to talk to all of you who are suffering from high, bad cholesterol, the LDL cholesterol that is high in your blood, and that your family doctor, your primary care doctor is trying to control and to bring to a normal value by giving you statins. Pay attention. The two most common statins prescribed right here in the United States of America and everywhere else in the world are Atorvastatin by far, which has the brand name of Lipitor, and Simvastatin, which has the brand name of Zocor. Atorvastatin, Lipitor, is right here in the United States of America as of January 2026, the number one most prescribed medication in the United States of America, Atorvastatin. These two statins work really good in most people, but there are a lot of people for whom they don't work. They don't lower your cholesterol level to a satisfactory level, which is less than 100, and the lower the better, right? So we receive a lot of patients in our beautiful cardiovascular and internal medicine clinic. Because we are expert in cardiovascular medicine, we receive a lot of patients, like this morning, this gentleman who was sent by his family doctor, his primary care physician, because the doctor was unable to lower enough the bad LDL cholesterol with Atorvastatin. And as you know, the more you increase the dosage, the more you expose the patient to side effect. And sometimes, even though you reach the highest dose possible, which for Atorvastatin is usually 80 milligrams per day, sometimes despite the highest dose, it just doesn't lower the cholesterol, the bad cholesterol LDL, to a satisfactory level, way less than 100. So the patient, what we do usually in our cardiovascular clinic, and a lot of family doctors, primary care physicians do not know about, and I'm giving you the tips so that you can tell your family doctor that Dr. B is telling you, recommending you this. Remember, I'm not your doctor. Only your doctor can change your prescription, but I can give you guidance so that you can tell your doctor that you saw Dr. B A+ on YouTube saying that if you switch me like we do, we cardiovascular expert at our beautiful cardiovascular and internal medicine clinic in the heart of Silicon Valley, Mountain View, California, if you switch me to rosuvastatin, also called Crestor, starting at 20 or 40 milligrams per day, 20 or 40 milligrams per day, many times it works, and your cholesterol goes back to normal. Obviously with diet and exercise, right? I mean, you cannot be a couch potato and think that any amount of statin, whether Atorvastatin and Simvastatin or Rosuvastatin, is going to lower your cholesterol if you don't diet and exercise. You need to do everything together, right? But many times it works. So remember, this magnificent statin, Rosuvastatin, the reason why many times it works way better than Atorvastatin and Simvastatin for lowering your cholesterol is because it has a two mechanism of action. You see, Atorvastatin and Simvastatin, all they do is that they inhibit, they impede, they prevent your liver, this magnificent organ that you have here, from producing bad cholesterol. Right? So that's the only way they work. They prevent your liver from producing bad cholesterol. However, this Rosuvastatin, brand name Crestor, has a dual mechanism. Not only it prevents the liver from producing bad cholesterol, it also stimulates, pushes your liver to take up from your blood the circulating bad cholesterol. So it has two mechanisms of action, whereas the Atorvastatin and Simvastatin have only one mechanism of action. This is a tip that many family doctors, primary care providers have absolutely no clue about. And in my experience, many years in our beautiful cardiovascular and internal medicine clinic, 5 minutes from my simple but beautiful apartment in the heart of Mountain View, California, the heart of Silicon Valley, this is an experience that I can bring to you as a tip so that you can inform your doctor and ask your doctor, in case your doctor has trouble regularizing, normalizing your bad LDL cholesterol with either of these two medications, despite optimal dosage, which I repeat, for Atorvastatin is maximum around 80 milligrams per day. Beyond that, you expose yourself to toxicity. So you can suggest to your primary care provider that you saw Dr. B A+. Don't forget to tell him Dr. B A+ on YouTube, and he's suggesting, doctor, maybe you can try to switch me to this magnificent statin called Rosuvastatin, Crestor, starting at 20 or 40 milligrams per day, increasing the dosage maybe from 20 to 40 or 40 to 60, based on what your doctor decides. But many times, it will absolutely normalize your bad cholesterol LDL because of its dual two mechanism of action on your liver instead of one, which is the case of Atorvastatin and Simvastatin. I love you guys. Don't forget the medication. Statins have to be combined with healthy lifestyle choices. That Dr. B A+ implemented about 10 years ago when I turned in my early 40s, about 10 years ago. Right now, end of January 2026, Dr. B, 50 years young. All my cardiovascular parameters, all my blood tests, every freaking thing are those of a baby, a beautiful newborn baby, thanks to these healthy lifestyle choices that I implemented about 10 years ago. It requires patience, it requires persistence, it requires a little bit of sacrifices. Remember, no pain, no gain. But once you see the results, you will be amazed, and believe me, you will not miss the ice cream, the cakes, the pizzas, the burgers, the fries, and all this stuff. You won't miss it, just like I don't miss them at all. They are part of my past. They are just part of my past. Remember, be steady, slow but steady. Persistence, patience, and make sacrifices when you implement these lifestyle choices. No pain, no gain, but I swear to God, it is absolutely worth it. Do not forget, write this name, the brand name Crestor, and of course the pharmaceutical generic name is Rosuvastatin. It's a magnificent statin. It is different than the other ones because it has this dual mechanism of actions. Most family doctors, based on our own experience, because we are cardiovascular experts, receiving a lot of patients from primary care providers who cannot control their bad cholesterol, and we give them this tip. We change the prescription of that patient and we switch them to this magnificent medication, and in 90% of cases it definitely works and the patients are happy, the primary care physicians are happy, and we have an excellent relationship with them. I love you guys. Dr. B A Plus loves you. I need your help to grow this channel so that I can reach more people with my knowledge and my skills before I die in 50 years from today, at the age of 100, healthy in my bed, in my sleep. I need your help so that I can pass on my knowledge. Knowledge that is not passed on to other people is useless. I need to pass on my knowledge before I die and go, God willing, to heaven, right? But I need your help. Remember, I want to keep teaching you for the next 50 years. Dr. B is not into retirement. It's just not going to happen. I am never going to retire from medicine. I am married to medicine. Medicine is my wife. I will keep doing medicine until I die, healthy in my bed, in my sleep at the age of 100. I'm done with all the traveling and all this stuff. I've seen the entire world. I have traveled to 62 countries. And I have lived in 6 countries. I speak fluently, written, spoken 5 languages. And I am right now learning the language number 6, which is the Thai language. And I'll be fluent in Thai language probably in 2 or 3 years. I love you guys. Life is a beautiful and long journey. If you know how to age gracefully, just like Dr. B, help me to grow this channel. Kopkun Makmak, Kopkun Nakrap, Sawadee Krap. Remember that Dr. B, when I took the Hippocratic Oath many years ago in Paris, France, when I graduated from medical school, I promised that I will love you the same, regardless of your ethnicity, color of your skin, religion, gender, sexual orientation. I don't give a cat's about any of those. As long as you're a human being, I love you. There's a good part in every human being's heart. You need to find it, and I love you all. But I need your help. Put your comments, your questions, anything you want to ask down there. Even negative comments I welcome, because Dr. B is open, Dr. B A Plus is open to criticism so that I can improve myself and this channel, and God willing reach more people. May God bless you and help you to stay always healthy and successful, just like Dr. B. And I hope to talk to you in the next video. Bye-bye.